counter to that really comes for what homeopathic doctors really talk about, and that is about what Dr. Nandini said about the latest research in terms of the doctor who spoke about nanotechnology. You would know better.
Is that for me?
Yes, Dr. Bagai, because you spoke about research.
The issue is they can proclaim anything, they can say anything. I cannot stop anyone from saying or expressing their views. It's a free country. But the fact of the matter is, homeopathy, as far as development and advances and transformation of its own science is concerned, is left behind a couple of decades back.
Okay, Dr. Nandini, quick rebuttal, and then I have to go to Dr. Noor.
Yeah, so Dr. Bagai is absolutely right that we cannot do dialysis or we cannot do deliveries. But yes, if you want an easy delivery, painless delivery, we have been giving homeopathy for it. We have been doing deliveries in the homeopathic clinic, hospitals. We have been giving and
Is that medically prescribed? Is that medically prescribed to do deliveries in homeopathic hospitals? Is that allowed in India? Is that medically prescribed?
Yes, in Nehru Homeopathic Medical College, I have done the deliveries with homeopathic medicine. Deliveries done by the allopathic doctor, Dr. Asha was there. But we gave homeopathy for fast delivery.
No, I don't get it. What does that mean? The delivery is done by an allopathic doctor, but the medicines...
Yes,
what does that mean?
See, delivery is a natural process. But for the pains, we have been, if there has been false labor pains, we have been giving homeopathic medicines for
Okay, wait a minute.
There have been a...
This is something new. I did not know this.
Yes.
Dr. Nu, come in at this point. You have been the past president of IMA in Kerala. What Dr. Nandini is saying right now is about, Dr. Bagai spoke about what about pregnancies? Why is that not happening here? Dr. Nandini is saying there are homeopathic doctors who do, there are homeopathic hospitals that allow, that have deliveries. What is this about?
Yeah, I'll come to that. Before that, I would like to say this. Anushka Sharma is absolutely right.
Is absolutely?
Having said that,
sorry, I didn't hear that.
Absolutely true. Absolutely right. In saying that homeopathy played a big role in her life. That is because she did not take any homeopathic medicine. Homeopathy is pseudoscience and it should be banned. It should be banned from any part. It should be banned from India. It should be banned from almost all developed countries. Started under promoting or maybe partially banning all these things like this. Homeopathy is pseudoscience. There is no evidence at all.
Dr. Bagai.
It's a free country. It's a free world. People can follow any path they want, but it's at their own peril. 100 years back, Dais used to conduct deliveries in the residence by putting a chadar around a lady. We've come a long way since then. What happens if a lady has postpartum hemorrhage? What happens if the baby is premature?
No,
what happens
Dr.
if
Bagai,
the baby
I'm sorry
has
I'm interrupting
asphyxia?
you here because I don't want people to go with a uncontested fact. And I'm saying that with all responsibility because I'm an anchor. I am not a medical specialist. I'm doing a debate and a discussion with medical specialists. If there are viewers who are going away after watching this, they should go with some sense and sensibilities. Now, suddenly something has been thrown onto the show that there is deliveries that are happening in homeopathic clinics, homeopathic hospitals. Dr. Bagai, how true is that?
No,
That
not
is
in the
not
clinics, I'll
allowed.
correct it.
All right, homeopathic hospitals.
That is not allowed. What happens if a cesarean needs to be conducted last minute? Are you going to be shifting the patient in a bleeding condition upside down to a tertiary care hospital? This is ridiculous. It's
Dr.
preposterous.
Nandini, come in at this point.
Yeah, I'm saying we have been doing deliveries, only the normal deliveries. We don't do C-sections.
Complications even during a normal delivery, Dr. Nandini, how does that get sorted then?
What was that? Sorry, come again.
Even complications can happen during a normal delivery. There's a whole lot of complications. My delivery was a normal, but with complications. How does that get sorted then?
Yeah, it is done under the supervision by the gynecologist. It is the
only what's the point?
No.
What's the point?
That is...
The homeopaths are not allowed to do deliveries. That is a limitation.
How can you take help from other specialists when your own line is incomplete? This is so ridiculous.
We are not saying our medicine is complete. We are saying we are giving as a supportive treatment there.
Then just remain supportive. Don't come into the mainstream.
No, of course, we have been giving you supportive treatment there.
No, they can't even be the supportive because it is pseudoscience and wasting money.
Okay, last question, and this is important. You know, people can pick and choose what they want to as long as they are informed with however they want to be informed and whatever they want to choose with. There are a lot of hospitals that are pushing for integrated medicines. And that's also what Dr. Rajan also seemed to have suggested, that this is not about inferiority, not about superiority. This is about integrative medicines. This is about tradition and modernity. Quickly, three of you, your takes on it. Let's start with you, Dr. Nandini, first.
I didn't get you. I didn't hear your voice. Could you
So
come
a lot
again?
is being spoken about integrative medicines.
That's right.
Integrative medicine, where you have alternatives coming together, working together, functioning together. I want all three of you, a minute each from three of you, to respond to that as your closing comments. Dr. Nandini.
So integrative medicine is the future, and homeopathy works on individualization of patients. We treat patient. We don't treat.
But you don't treat conditions. You don't treat conditions. You don't
No,
treat patients.
but
I didn't
we treat
understand
the
this.
symptom.
I read this quote. I did
Yes,
read
we
this quote, but
treat
I
the,
just didn't get it, that you do not treat conditions, you do not treat diseases, you treat patients. I did not get it.
For example, Dr. Bagay said we were not ineffective during COVID time. You must have seen a lot of people how Aspidosperma mother tincture worked it. And we have a huge data when homeopathic medicines were given, how homeopathy has helped. Even homeopathic medicines were given as a supportive treatment, not as an individual only treatment, as a supportive treatment in the ICUs, and they were and the whole data is there with the CCRH and how the homeopathy has worked.
Dr. No, respond please.
Yeah, I will say this. In 1947, when we got independence, our life expectancy was around 25 to 30. 25 years, the people used to die. Now the life expectancy has gone to 70, 65, 70. That is because of modern medicine. That is proven beyond doubt. So if we are planning an integration that is going back to the pre-independent era in which there was only pseudoscience. So I think we have to, the government must take a bold decision in not supporting this pseudoscience, and they have to spend our money, our tax money to the genuine medicines that's proven beyond doubt, and which is evidence-based medicine, that is modern medicine. I think that should be the way, and many countries have already approached that scientific approach.
Okay, Dr. Bagay, your last minute.
My take is that we cannot live in Alice in Wonderland. We are living in a real world. And I think we can't be going blind and blindfolded in the dark. Homeopathic is not a complete science in 2026 going forward. It's been left far behind. It's not evidence-based. Whoever follows it, it's at their own risk. I am firmly against the mixopathy concept of having these kind of all different kinds of scientific medicines trying to be put into one bottle. Science exists in homeopathy. There is no disputing that.
Okay.
They are happy with it. I'm happy with what I'm doing. Patients take the final call. My patients don't take homeopathy.